lymphedema is swelling that occurs when lymph fluid builds up, usually in the arms, could be in the hands or the chest. The risk increases after breast cancer, especially if lymph nodes were removed or radiation is used. And these treatments will disrupt that normal lymphatic drainage. Starting physiotherapy early is very crucial in order to maintain proper lymph flow. And by waiting until there's more lymphatic buildup, the lymph system may already be compromised, therefore making that recovery much longer. Radiation fibrosis or scar tissue can impact the flow of that lymph. I often describe it to patients as, imagine there's like a kink in the hose. And our goal as physiotherapists is to remove that kink to allow things to flow better, whether that is through manual lymphatic drainage or through scar mobility and scar massage. Prehabilitation prepares patients for surgery and protects the lymphatic system. And physiotherapists, we will teach safe postures to avoid compressing the lymphatic pathways. We will also talk about activity pacing to prevent any overload to those areas affected, and gentle arm-shoulder exercises to maintain mobility. After surgery, early care will focus on preventing stiffness and promoting lymphatic flow. So early treatment, or specifically range of motion exercises, manual lymphatic drainage, this can help maintain that flow and not let that lymphatic system become compromised, again, preventing quick recovery. We teach patients to look out for a few signs, such as heaviness, any pain or achiness, any tingling, fluctuating swelling in those areas affected, as well as fatigue. And recognizing these early signs will allow for prompt intervention to manage fluid buildup and prevent lymphedema progression. Restoring shoulder and arm range of motion and movement will help the lymphatic system function optimally, because those muscles, they act as a pump, moving lymphatic fluid efficiently. And while proper joint movement will help reduce the risk of obstruction and long-term swelling. For patients who are eager to return to exercise or to work, we do emphasize a gradual introduction of these activities. We talk about breaking up their tasks. We talk about manageable steps to do so, and breaking up their tasks into like smaller chunks, so they're not just going from 0 to 100. We often notice a lot of improvements in patients by doing so. Patients don't often come back with pain or discomfort or achiness from getting back into their activities too quickly. And then we also tell them to, or help them manage those early signs that we've talked about: the heaviness, the achiness, the swelling, and the fatigue. Those who take that step to come in to get this worked on, preventative care, we often do see that they're able to return to their daily activities pain-free much sooner. We definitely see these patients less at the clinic because they're already taking steps to help improve their swelling, their lymphedema on their own, even without our hands-on technique. And they might come in, let's say 1 time a month, rather than 2 times a week to help, because they're keeping up with their exercises to help improve their mobility at home. Even if they have developed mild lymphedema or swelling, it is not too late for physiotherapy. They should definitely come in for assessment. Again, there's a lot that we can do for them in the session, including manual lymphatic drainage, but also teaching them a variety of techniques and exercises to help them do this stuff at home, to regain their confidence and to improve their quality of life. Many patients, they believe that avoiding all activities or using that affected area as little as possible will help to prevent lymphedema. However, with gentle movement and proper exercise and pacing, this is not something that they have to do. They'll be able to improve without having to stop those activities that they enjoy. The best next step is to see a physiotherapist experienced in lymphatic treatment. We will be able to assess what is going on and allow them to return safely to exercise, posture training, scar management. Our goal is really to get them back into doing the activities that they love and not have them feel like they need to stop those activities because they're scared of that lymphatic buildup. So the proactive approach is to seek help and to see a pelvic floor physiotherapist and get started on this treatment as soon as possible.